If you have problems with your shoulder, impingement, calcific tendinitis, osteoarthritis, pain in general, then stay tuned. I am Liebscher Bracht, and I will explain to you how these conditions can emerge according to our understanding and our specific approaches against it. So that you can understand this, I will explain the anatomy of the shoulder in a simple way. You see the humerus bone? Here is the joint head, and there is a small socket, which is barely visible. So, a large head with a very small area where it moves, and that means you have a very large range of motion, at least as a possibility, built into the body. But that also means that the muscles around it are especially important for stabilizing this joint so that everything fits as it should. And because there are so many muscles there, the rotator cuff, small, larger, and very large ones, many patients, as well as therapists and doctors, think that treating the shoulder is difficult. Precisely because there are so many muscles, it is difficult to associate these muscle functions or what goes wrong with them with specific pains or other injuries. As with all other types of pain, the numbers for shoulder pain are also increasing, with more and more people having problems with it. 70% of the population will experience a significant issue at least once in their lifetime, but specific causes when someone goes to the doctor or a physiotherapist are often not identified. And if they want an explanation of how all this comes about, no specific cause is usually mentioned. They might say it's due to congenital factors, weaknesses, or inflammation. However, we know the specific cause. Yes, and this conventional approach to dealing with shoulder pain has led to around 100,000 shoulder prostheses being implanted each year in Germany alone. And if you ask me how all these problems arise, here's the explanation. Pain, arthritis, and many other shoulder conditions are related to us not moving our shoulders enough in all directions. We mostly have our arms in front of the body. We hardly have them up. We have them very little only behind. And all of this limits the range of motion drastically. If we are able to have a 100% mobility in our entire body, we only use a maximum of 5 to 10%. I once calculated, as a mechanical engineer, that we use the shoulder joint less than 3% of its capacity. Now you are probably wondering about this small number. I can explain it to you very easily. We almost always have the arms here in front, in this angle, and not much else is happening. And at the moment when we are here, when we are there, when we are internally rotated there, when we are externally rotated there, you know or can guess what a variety of angles come into play. The ones we don't use anywhere near enough, which is why this massive underuse leads primarily to two types of shortening. The first shortening is in the front area here, the biceps and chest muscle. All this is due to the fact that the arm is in this position, always getting shorter, and the tensions around the joint become so high that the head is pulled higher, yes, so it usually has a certain distance to the acromion. This bone here is called that, but when everything is getting tighter, it is pulled higher, which causes the supraspinatus tendon to be pinched. The bursa gets compressed, becomes inflamed, and on top of that, another effect occurs. Due to insufficient movement, the tissue becomes increasingly acidic and water is expelled from the fascia. Because the ability to bind water is lost, meaning it dries out more and more, calcium deposits build up, creating actual calcium pieces in the tissue. This is how calcific shoulder occurs. And of course, to pain, the so-called alarm pains, which are the pains the body sends to protect the structure, if you haven't fully understood this yet. Then please click here. There's an explanatory video. These alarm pains are ultimately due to excessive tensions, so you always need to keep an eye on the excessive tensions. They are the actual problem, and they also lead to arthritis. Excessive pressure during movement wears down more than lower pressure and the restricted range of motion. As a result, the uncompressed cartilage areas start to starve due to the lack of movement, and this double effect leaves little chance for any joint to escape. That's why arthritis is so common in the hip and knee joints. Yes, even more than in the shoulder, and because the humerus bone is always pulled up further, this impingement occurs. You have to understand there is the supraspinatus here. This is a muscle that originates here, runs down here, and then goes to the arm, and if it is too compressed by this narrowing, then the tendon of this muscle begins to split, it becomes more and more worn out, the muscles there eventually tear, and this leads to pain, the bursa is pressed too much, becomes inflamed. Please note, inflammations in this area are always a repair measure. This is not something bad, this is something good. Whenever there is inflammation, it is something positive, because inflammation repairs. And these calcifications, they can become so drastic. We had a case, Alex from our practice in Hamburg told me about it. There was a patient, a tennis player. She had formed a proper block of calcium around the supraspinatus tendon. You have to imagine what the body is building there. Yes, it wants to get rid of its calcium somehow. What it has in excess, it deposits where there is space, because no movement occurs. Where the tendon moves a little, a channel is cleared, and around it, there is essentially a single layer of calcium deposit. But that was a great example, because after the tensions were relieved through our exercises, the lady was completely pain-free, despite the huge calcium deposit she had in the shoulder. Completely pain-free, full mobility, so the calcium is apparently stored in such a way that it still retains its function when the muscles start working again, because the tensions are normalized. And there is another effect that is not necessarily attributed to shoulder pain, but is directly related to it, namely the numbness of the hands, arms, fingers, cold hands, and so on. Always remember our model. The tendons, blood vessels, and nerves always pass through the tissues, and at the moment when these tissues are under too much pressure. Yes, the blood vessels, the lymphatic vessels, the nerves, those are like small flexible tubes you have to imagine, and at the moment when you press on these tubes, it's like in the garden. You're standing there watering your flower bed, and then you step on the hose with your foot, and suddenly the water doesn't flow through anymore. It's exactly the same in the body, and this is something that's given far too little attention. So remember, if you know someone whose fingers go numb at night, they should relax the neck and shoulder area, and then the numbness will disappear as if it were never there. Yes, and what is usually prescribed? Painkillers are usually prescribed, but please, I always say, what does that solve? That does not solve the problem. Maybe the pain is dulled, but often that doesn't even work. Yes, but if it is suppressed, it is actually dangerous, because this alarm pain is sent by the body to protect itself from injuries and damage. It is turned off, and you can't turn off an alarm that warns of something. Always think of my example, you're driving on a highway, and the oil warning light comes on and you put a band-aid over it or tuck the cable away so you don't see it anymore and keep driving. No sensible person should do that, because that could lead to engine seizure. What does a person do? They pull over, eventually at the next gas station, and add oil to make everything right again. And that's exactly how we should treat our bodies. We should think, okay, why is this alarm being sent? That's why if the tension is too high, you need to reduce it. When you take painkillers, you're not changing your condition. You're just getting through the painful time. Most of the time, you end up needing to take more and more, especially if it's chronic pain. That is not a solution. That can be done for a short time, but never for a longer period, because the painkillers also have significant side effects that nobody wants. I always recommend carefully reading the package brochure, because then a lot of what is mindlessly taken over and over again might not be taken anymore. At some point, the impingement surgery, which is the most common shoulder surgery, appears as the last resort. Now pay close attention. So the humerus bone, which has been pulled higher due to the excessive tension of the muscular fascia, has caused impingements here. It has also caused bony changes here, with so-called osteophytes sticking out a bit. So changes occur simply as reactions to the excessive pressure. What is done now? If only the osteophytes are removed, I would say that's still acceptable, although it's unnecessary, because we have had so many patients where it was very clear that this wasn't needed. And when the tension was normalized, they didn't pose any problems at all. It's more of an aesthetic issue, but it gets pushed so far that bone is shaved off from the acromion. Bone is shaved off, and the idea is that there will be more space. But excuse me, what is being pulled up, or rather what is pulling up, still continues to pull the bone upward, meaning that if I remove something here now, there will only be more space to be pulled up and it will become tight again. So this is absolutely not a solution because it does not bring any positive change. It does not solve the cause. And the reason why after such surgeries there is at least temporary pain relief or reduced pain is simply the anesthesia, because the anesthesia relaxes everything. That means the tension. The real cause of these pains is reduced at first, and that lasts a few weeks, a few months, and eventually it starts again. And even a shoulder prosthesis does not solve the problem at all. Of course, it might always feel better for a while due to the anesthesia, so please pay close attention. I argue that many of these surgeries, including shoulder surgeries, actually reduce the pain or minimize it temporarily because of the anesthesia or also because of the surgery itself, because when it is cut, depending on what kind of surgery it is. There, muscles are injured, tissue is injured, and this in turn reduces the tension, which is the real cause and once again, my urgent claim. Please share this video with everyone you know because this information should actually be taught in schools. It should be part of the curriculum so people could better manage their own bodies and pains. And many cases wouldn't even occur if people were aware of this information. So share this knowledge and you will also be part of our vision to make the world pain-free and help people. Be a part of this movement. So what do we have to do? Yes, what we always do, we stretch, but on this occasion may be very important to understand. Our stretching exercises, our special exercises are not only for stretching, they also strengthen, but they strengthen in a completely different way than you are used to. The strengthening exercises do not increase the tension, do not favor shortenings, but actually strengthen the muscles. Simultaneously, the flexibility of the muscles occurs, which your body and shoulder need. And when you do this, a positive cycle is created from the negative cycle of deeper pain. Because by stretching, you increase the possibility to move, especially the pain is initially gone. Yes, the pain disappears first, the movement becomes more, thereby the metabolism in this area is increased. This leads to increased loading and unloading of what was previously inactive and shut off, meaning life returns and tension gradually decreases and normalizes. Yes, and the shoulder is fully mobile again. Damages can be repaired, even though many people still do not know that. When you raise your arms, you'll notice something completely crazy. This was a few years ago. It might have changed since then, but there was a time when kitchen manufacturers started including small step ladders with the kitchens they delivered. So you were buying the step ladder along with the kitchen. Why? Because many people can no longer manage to place the plate up there. They had to climb up the ladder in order to be able to store it in the upper cabinet. All of this leads to such problems. And instead of just placing something on the shelf, try consciously using the step ladder to see if you can reach or adjust things further. This can become an automatic habit. You just have to keep in mind, I want to move my arm in all possible directions over and over again. That is a wonderful addition to the exercises. And it will ease your progress into a pain-free state with full mobility. Also, here's a very important test for you. Lie on your back with your arms extended to the sides and see what happens. Whether you can touch the ground with your shoulders, many people can't do that anymore because they have such a shoulder protrusion that they can't move backwards. Because everything is too short here in the front, and that is a wonderful way to remember the goal. And that motivates you even more to do the corresponding exercises. So ultimately you solve the problem by eliminating the tension, shortening, and increasing movement again. You can also check out our YouTube channel for more videos on other topics. Feel free to try new exercises for other parts of your body.